So in the research that we undertook, we asked a panel of experts, mental health professionals, and a panel of experts by lived experience to look at some of the content that we'd analysed in our data and to say what they thought would be helpful or harmful from these videos. So some of the information is really helpful. It's clear, it's reliable, it's informative, it's freely available, it can be presented in a really balanced view, and it can help somebody decide, well, do I need to seek professional help or not? And that's especially helpful if there's a link to information and further support that's available. So that can be really helpful. And conversely, there can be information or content that is really not helpful, clearly not helpful because it's inaccurate or misleading, a form of misinformation. It might cause somebody to stop taking treatment or to turn to some kind of help that's not helpful at all. There also can be help in terms of people who are sharing their lived experience. This can be inspirational, it can be really encouraging, it can help somebody feel that they're not alone in their journey through a mental health challenge. But conversely, actually sometimes that can be really difficult as well. A journey through a mental health challenge can have its ups and downs. So sometimes seeing that can seem distressing. And sometimes the solutions that a person presents that's been right for them as an influencer might be out of reach for the audience. And so it can be difficult because is that strategy, is it going to be helpful for the person who's watching? Can they actually use that? So it's not just what information is helpful, it's about what's helpful for a particular person at a particular point in time. Even with really good, reliable content, it's how a person interprets that. It's how it sits with that person at that particular point in time in terms of their mental health journey, even at that point within a particular day when they're looking at content, how they respond to it. The young people that we talked to in our study told us that even with really helpful information, there could be some perhaps unexpected negative impacts from that. So for example, they talked about how with mental health awareness raising campaigns, sometimes they might feel more anxious when they've been told about a particular condition. They talked a lot about self-diagnosis, which does have its value, but it's not always helpful. They also talked about the way that clickbait images create curiosity. So you might see something that you look at and you go, what is that? What's going on there? And then clicking on that content takes you to something that is more distressing to look at afterwards. Especially in the context of eating disorders, there can be content that's triggering and distressing, even when somebody is sharing a recovery journey. It can be that that is unhelpful and distressing for somebody to see. And it can be that the way that algorithms work, that once you've started watching something, then more content comes to you that is not helpful also. So there can be a range of ways in which a person really needs a lot of help in terms of interpreting and applying and understanding the content that they're seeing. And that's really where digital literacy comes in.